All right, so we're gonna do cranial nerve number 5. This one's loaded, trigeminal, okay? In this case, I'm gonna test part, and then little J is gonna test the other part. So I'm gonna test light touch. Okay, so light touch is gonna be 3 areas that you're gonna do. One is what's known as ophthalmic, which is the forehead, okay? And the other one is maxillary, and the last one is the mandibular. Okay, so when I go to do this, what I'm going to do, look straight ahead, and I'm going to have him close his eyes, okay? And then I'm gonna basically use light touch. Now I could use, you know, a pin or, you know, like more like a paper clip, but I'm gonna choose to use a cotton ball, and I'm gonna do what you call the swipe, okay? So I'm gonna take this and I'm gonna swipe across, okay? And then obviously, okay, normal would be is if he's able to localize the stimulus and actually determine, okay, where I touched him. So if I wanted to, I could close your eyes, I could touch here and then ask him where I touched and point to it, Joseph. Okay, perfect. And then if I touched here, point to it. Okay, now I could come down and I could touch in terms of the maxillary area. Okay, so if I'm going into the maxillary area, okay, then I'm gonna come down, okay, and swipe across here, touch here, and see if he touches. So point to where I touched. I could come in the mandibular area, okay, here, and see if he knows where I touched him, okay, and maybe catch the maxillary on that side, and he could touch, and then maybe come down and touch the area for the mandibular there. Okay, so now could you do sharp toe? You could do sharp toe. Either way, you're touching. What are you doing? You're looking at light touch. So we're looking, if it's impairment, then you're talking about anesthesia, right? Which is in affected area, meaning they can't feel it accurately. Okay, or I'll tell you what'll happen, and I've seen this. And that is, if it's severe pain in the trigeminal, okay, and that's the branch, okay, what'll happen is it's gonna be really painful.
They have trigeminal neuralgia.
Yep, and that's where they're gonna have a lot of pain with that. So that's the first test. Now, there's one other that I'll do, and that's the corneal reflex. Now, what's interesting about the corneal reflex is you wanna go towards the cornea, and you can open your eyes, okay.
So I just thought of that.
Well, I know. And what happens is when I go in, here's the cool part. Before, and he doesn't have an issue, but when I go in, what's going to happen is I get close enough, okay, and he's going to blink, okay, and so I'm going to come across. Yep. A lot of times the client, you want them to blink. That's the reflex. Okay. You'd rather not have to touch the cornea. Okay. All right, but if you go straight in and you come off to the side and you touch. Now, if they ultimately blink, okay, initially, okay, that's going to let you know, okay, that it's, you know, the reflex is in check. If they're not blinking and you're going all the way in and touching, then Houston, we got trouble.
Right.
All right, and that's going to be the problem. So, so that's the touch in terms of the
sensory
trigeminal,
yeah.
Right. Now we have a motor.
Yep, the motor piece is when we're doing manual muscle testing of jaw strength, because the trigeminal nerve innervates our muscles of mastication, which allows us to chew our food, right? So if I'm doing manual muscle testing of jaw strength, what I'm gonna do is I'm gonna change positions here, and hopefully you can see me here. But what I wanna do, just like when you're testing the upper extremities, the arms, you always wanna make sure you have a hand stabilizing, and that doesn't change here. So I'm gonna have one of my hands stabilizing on the head to provide kind of a counter force to resistance that I'm gonna be providing with testing my strength of the jaw here. So what I'm gonna do is you wanna instruct your patient to have their mouth about partway open because you wanna test in the mid-range. So Big J, go ahead and open your mouth about partway. Great. So what I'm gonna do here is, you can see that my thumb is right on the chin bone. And at first, what I'm gonna do is I'm gonna test mandibular elevation, which would be closing the mouth. So what I would do, again, is I'm going to ask Big J, I'm gonna say, try not to let me move you, and I'm gonna apply resistance downward. And so if he doesn't move or if he doesn't break, then I know that he has good strength of the mandibular elevation. Again, that would be closing the mouth. Now, if he breaks, And those muscles for mandibular elevation are decreased in their strength because he wasn't able to hold that position. I'm going to check mandibular depression next. Mandibular depression on the opposite end of that is being able to open the mouth. So you can go ahead and show him there, big J. That would be mandibular depression. Again, the way I'm going to test that is I'm going to have him start in a midway position, mid-range position there with the mouth open. Maybe a little bit more close there. There you go. And then what we're going to do, I'm going to have my hand position be the same. My thumb is going to be right on the chin bone here. And then again, I'm looking at that mandibular depression there, which would be the ability to open the mouth. So what I'm going to do is I'm going to provide resistance in the opposite direction, and I'm going to say, don't let me move you. That would be for testing mandibular depression.
So there you have it. That's the trigeminal nerve, which is cranial nerve number 5.